that can produce sudden cardiac death. So that would be a good thing to pick up. So here is a patient who had 3 episodes of almost sudden cardiac death, severe chest pain and collapse, but continued to live. On a cath angio, they couldn't cannulate the RCA. So here is why they couldn't, because the RCA arises from the left coronary cusp and goes between the main pulmonary artery and the aorta. Obviously, at each time she had an episode, it was when she was on a treadmill. Now you can imagine that she's on a treadmill, she's reached peak heart rate of, let's say, 150, 160. The aorta and the pulmonary artery have dilated to 1.5 times their size because they have to pump more blood. And then obviously this poor artery gets compressed and the patient can land up with ischemia and then sometimes sudden cardiac death as well. That is the role of cardiac CT. It's restricted to the coronary arteries as of today. And within that, your role is to image patients who are either at high risk or who you're following up or post-CABG. But a patient has acute chest pain with ST elevation, ECG, you will not do a cardiac CT in that patient. That patient goes directly for a cath angio. Right? Remember, the population of patients that we are dealing with when we do cardiac CT is very different. And ideally, your cardiac CTs, most of the cardiac CTs that you should be normal. So when you're doing that, then you know that you're targeting the right